this from Jeffrey Klausner, who's a professor of medicine and public health at UCLA's Geffen School of Medicine and Fielding School of Public Health. He joins us now live from Los Angeles. Really great to have you back. First of all, when we look at China's rates dropping and sort of the outbreak ramping up elsewhere, what sort of lessons can we learn and how China has dealt with this?
Well, what we're seeing across the globe now are these very localized outbreaks. They go up quickly and then they come down. So China's outbreak peaked in about 15 days and then came down dramatically. South Korea peaked in about 10 days and then came down dramatically. We don't know how much the different control measures of quarantine and isolation and community lockdown, how important that role was versus just the natural immunity to infection. So like many viral diseases, someone gets infection, they clear the infection, and they're immune to repeat infection, and then the virus has no more new people to infect.
We heard an update from the Corona Task Force here with the Trump administration talking about how really communities are at the center of this. Yes, that there's a lot that governments can do, but really communities need to take charge with relaying to people how to keep workplaces safe, homes safe, commercial areas safe, sort of with all of the information out there, with all of the misinformation out there. What can you tell us about what everyday people like you and I can be doing to prevent the spread of this? Certainly a very disturbing development. The virus has made its way to a nursing home in Seattle where it's reported, Reuters is reporting that 13 patients have been killed there. And we know that people over the age of 60 are very vulnerable.
Right. So we definitely know that the elderly, people with chronic medical conditions are particularly vulnerable. So we need to protect ourselves from getting infected so we don't spread it to people who are vulnerable. The best ways are to wash your hands regularly, to avoid contact with sick people. If you're feeling sick, such as symptoms of fever, cough, headache, and fatigue, call in sick, don't go to school, and don't put other people at risk. Cancellation of mass gatherings and events that was put in place. Certainly in China and in South Korea, there may be some benefit to that, but it's really hard to say. I think the most important thing is that individuals take individual action to be aware of their risk for infection, take precautions such as hand washing, covering your sneeze and coughing, and not coming in contact with other sick people.
Up until a few days ago, the U.S. didn't even have enough testing kits to deal with this outbreak, and it looks like this may be one of the reasons why in this Seattle area nursing home was the fact that COVID-19 was not identified there. Do you think that the Trump administration is doing enough to prevent the United States from a full-blown outbreak? What is the likelihood that the United States could turn into something as big as Italy?
Yeah, I think that's extremely unlikely. The U.S. population is very diverse. There's very, varied weather patterns across the country. One thing particularly interesting is that in every major city, whether it be in South Korea, in China, in Iran, in northern Italy, all those cities where there have been outbreaks have been generally cold temperatures, around 8 to 10 degrees centigrade, and it seems that the virus spreads more effectively in that colder, drier weather. So we're not really seeing any generalized spread of infection in any warmer climates. In terms of the tests, so the United States has a very strict regulatory system. Before a test can reach a patient, it has to go through a rigorous evaluation and review process, and that does take time. The CDC, which invented the test and made the test initially available, they're not set up for manufacturing and distributing. That has to go through the commercial sector. And for the commercial sector to make tests available, they have to go through a regulatory process. So all these are steps put in place to protect people from false tests or tests that don't work. But this week, we're seeing a rapid increase in test availability. The medical care system I work at here in Los Angeles has tests available, and the large commercial tests large commercial laboratories across the United States all have tests available. So testing access should no longer really be an issue.
All right, Jeffrey
All right.
Klausner, great to have you back. Really appreciate it.